Adult Smoking in Weld County, Colorado by Nicole Mapes. Weld County totals about 4,000 square miles, 31 different communities, and over 260,000 people. In the county, there's 62.3% are adults between the ages of 18 and 64, 27.2% are children under the age of 18, and 10.5% are elders 65 years or older. In the county, there's nearly a 50-50 split between males and females, and the two most prominent ethnicities in the county are Caucasians at 67.4% and Hispanics at 28.4%. The median household income is $51,773, which is actually down from the $55,588 back in 2000. The poverty risk is 14.3%. Unemployment rate is 7.1%, and households on food stamps is approximately 9.2% in the county. In the United States, smoking is considered the largest preventable cause of death and disease, killing more than 480,000 people per year, with 41,000 of those being from secondhand smoke. Because of this, the national average for smoking is 21.7%. In Colorado alone, about 4,300 people die each year from tobacco-related diseases, and 630,000 people are considered to be active smokers within the last 30 days. In Weld County, 17.1% of adults 18 and over reported to actively be smoking. And some of the reason why this is such an issue is because smoking can cause problems with chronic lower respiratory disease. And as you can see, 53.7% of adults have this disease in Weld County. And smoking is also a risk factor for having poor overall health, and 15.4% of adults in Weld County have reported to have fair or poor health. Smoking is also a major issue because of its long-lasting negative effects on the individual, friends, and family, and the community as a whole. Current smokers have double the risk of impaired activities of daily living, and the risk increases with the number of cigarettes that an individual smokes. Smoking also causes low bone density and bone loss, which can increase the chances of hip fractures and balance issues and falling. The use of tobacco products increases the chance of illness, causes sleeping disorders, and can lead to more missed days at work and a lower paycheck. Families can suffer from this by the lack of income and the increased rates of health insurance. Adult smoking also affects the community members through secondhand smoke, which can increase the risk of heart disease by 25 to 33% and coronary heart disease by 60%. Other issues that secondhand smoke causes is an increase for the risk of stroke, dementia, respiratory diseases, and women who smoke while pregnant run the risk of preterm delivery, low birth weight, miscarriage or stillbirth, and can harm the lungs and the fetal artery of the child. The first step of any community health project is the organization process. The National Association of County and City Health Officials says that organizing tasks and creating partnerships is important in order to structure a planning process that builds commitment, engages participants as active partners, uses participants' time well, and results in a plan that can be realistically implemented. By spending the necessary time to lay the groundwork of the project, everyone understands the time frame of what is to be expected and their personal role in making that happen. To begin this step, we identified the Weld County sponsors and stakeholders. The sponsors include the American Cancer Society, the Weld County Department of Health and Environment, and the North Colorado Medical Center, which is the largest hospital located in Greeley. The American Cancer Society has a strong background and invested interest in researching, educating, and sharing prevention and treatment methods in communities to promote healthier populations all over the nation. A major contribution is the Great American Smokeout, which began in the 1970s and challenges and motivates people to quit smoking on the third Thursday of November every year. The American Cancer Society's dedication has led to funding multiple community programs and implementing smoke-free laws. The Weld County Department and the North Colorado Medical Center will also be valuable resources as they have a better awareness and understanding of the demographics and needs of the community. They are able to provide health statistics, recognize barriers, identify areas of focus, provide necessary medical resources, screenings, and treatment, and collaborate with local residents and organizations to receive funding and evaluate the program. These three sponsors make up the core support team, and they are responsible for the majority of the work and seeking further partnerships. Playing a more minor role on the MAP committee are the stakeholders North Colorado Health Alliance, Group to Alleviate Smoking Pollution, the University of Northern Colorado, Ames Community College, Sunrise Community Health, and local primary physicians. The North Colorado Health Alliance Agency will be essential in collecting and analyzing data, evaluating the program, conducting needs assessments and focus groups, identifying funding sources, and maintaining current inventory of community assets. The Group to Alleviate Smoking Pollution will assist in smoke-free housing, secondhand smoking, and public smoking laws. The two colleges in the area that are listed will help to educate younger generations and future health practitioners. They will also provide volunteers for the program when needed and provide rehabilitation to those who are suffering from smoke-related cancers through the Rocky Mountain Cancer Rehabilitation Institute at UNC. The Sunrise Community Health organization will serve as a vital component to connect with the underfunded and minority populations, and the primary physicians will provide counseling, one-on-one attention to patients, and become the liaisons between the sponsors and the Weld County population. For the visioning process, we will use community visioning, which gathers 40 to 100 people together to discuss and collaborate on health and community issues. This format is a better representation of the population, their needs and desires, and allows for greater community commitment, trust, and support. During the discussion, the individuals who are chosen will share their thoughts, feelings, and ideas that relate to a set of vision questions posed to them. Some of these questions are listed on the screen, and they include what does a healthy, smoke-free community look like? What inequalities need to be addressed to reduce adult smoking rates in Weld County? What efforts are or have been effective to reduce adult smoking rates? And what will the growth and development of Weld County look like when smoking is no longer an issue? After discussing the visioning questions, a vision statement can be constructed to guide the operations of the public health project. The vision statement for adult smoking in Weld County is to promote, encourage, educate, and empower the Weld County community to prevent and eliminate the participation in adult smoking, to reduce unnecessary health disparities and secondhand smoke, and foster a smoke-free environment. 4 value statements were created to ensure that the vision statement stays at the focal point of the project at all times. The first statement is to ensure everyone is provided education and awareness of the impacts of smoking in their own language. The second is to ensure access to and awareness of resources available to quit smoking. The third is to foster an uplifting environment to encourage and support individuals to quit smoking. And finally, the fourth is to commit to serving residents with respect, care, and dignity to meet the needs of the individual community at their level of understanding and desire to quit smoking. While assessing Weld County, community assets were identified, such as the Tobacco Free Coalition, multiple local organizations, the City of Greeley Transportation, and family and friends. The Tobacco Free Coalition is a service collaborating between multiple networking organizations that are working together to help active smokers quit. Together, they offer information, classes, helplines, and support to decrease the amount of smokers in Weld County and the health conditions related to secondhand smoking. The American Cancer Society, North Colorado Medical Center, primary care physicians, and North Range Behavioral Health offer counseling services, treatment services, and educational material to help those who are trying to quit. The North Colorado Health Alliance has assisted in establishing policies, laws, and ordinances throughout the Weld County area, and the Group to Alleviate Smoking Pollution is an organization that offers educational material, housing and resident resources for smoke-free living, information regarding local smoking restrictions, and links to various networking web resources. The City of Transportation is a necessary asset as it provides accessibility to the services mentioned earlier. And family members and friends are also important to motivate and assist those who are trying to quit. The behavioral factors that were discovered during the assessment include poor home environments, excessive binge drinking, teen pregnancy and low socioeconomic status, and physical inactivity. Poor home environment. The Geisel School of Medicine at Dartmouth states that 47.8% of adolescents who try smoking before 9th grade and 90% of adult smokers start before the age of 18 due to family and parent influences. They also mentioned that parents who allow their children to watch R-rated movies increase the chances that the child will become an adult smoker. Binge drinking, as you can see, is a major issue in Weld County as 16% report binge drinking. And this is essential because there is an association between binge drinking and smoking, as binge drinkers are more likely to smoke than those who do not drink. Females who have a child in their teens are also a cause for increased smoking risk, as they are more likely to live in poverty in their adult years. Those individuals who live at a lower socioeconomic status in their adult years can lead to an increased chance of smoking, and in Weld County, 41 out of 1,000 girls give birth as teenagers. Finally, studies have indicated that individuals who are not active have a higher risk of becoming smokers, and in Weld County, 21% fail to participate in daily physical activity. The main policy concerning adult smoking is the Clean Indoor Air Act, which was enacted in 2006 and prohibits smoking in any indoor public facilities, workplaces, healthcare buildings, and public transportation. It also prohibits smoking within a 15-foot radius of entryways. Individuals are still allowed to smoke in the privacy of their own homes and cars, in designated hotel rooms, designated smoking areas at the airport, and cigar tobacco bars. Since 2006, Weld County has enforced a no smoking policy within 50 feet of public building entryways, making it more strict to smoke in Weld County than in the rest of the state of Colorado. Based on the visioning and assessment phases, 4 strategic issues were identified. The first issue focuses on targeting the adult population with smoking cessation information and materials. According to the Centers for Disease Control and Prevention, 90% of adults who smoke cigarettes started before the age of 18, and 2,100 youth become daily cigarette smokers every day. In 2014, over 70% of high school students and more than 40% of middle school kids were current tobacco users of flavored products. This is also an issue because tobacco companies target younger generations, and those who participate in smoking tobacco at a younger age are more likely to develop nicotine dependence and have an increased risk of smoking-related concerns. The goal for this strategic issue is to work to educate children and teens alongside the adults in the community to help inform them about the health risks and consequences associated with smoking and hopefully reduce the prevalence of smoking in Weld County. The action steps needed to attain this goal include partnering with local schools and universities to create awareness about smoking, teaching them about the Tobacco-Free Coalition, and sharing no smoking laws. The second strategic issue focuses on the disparities in rural and low socioeconomic communities that limit access to resources. Less than 10% of healthcare workers choose to work in a rural community, and these communities have very poor transportation. In fact, 60% of the rural areas have available transportation for the services, making it difficult to receive the necessary treatments and counseling to quit smoking. In order to, the goal for this strategic issue is to collaborate with the local public health representatives as well as the CDC to identify, evaluate, and eliminate disparities. The action plans for this goal include partnering with the CDC to create morbidity and mortality weekly reports, create focus groups, and hold key informant interviews in order to learn more about and understand the attitudes and barriers that keep residents from being able to quit, and provide better transportation, health fairs, a 24-hour hotline, and online information for easy access. The third strategic issue is that health insurance companies may not cover the costs for smoking cessation. Counseling and pharmaceutical therapy are effective treatments when combined together. However, not many health plans provide the necessary coverage plans. In fact, there are many health insurance companies that do not provide any plans to help with smoking cessation at all. The goal for this strategic issue is to increase the number of insurance plans that will cover adequate treatment plans and education. The actions associated with this goal include educating about the importance of smoking cessation, reaching out to state governments in order to increase Medicaid coverage, and also reaching out to federal governments to include cessation benefits in their plans. The fourth strategic issue is that local physicians may not feel equipped or may feel undercompensated to serve community members. Advising and assisting patients to quit smoking is the most important intervention that clinicians can offer to those who smoke. By simply asking patients if and why they smoke, advising them to quit, and providing them with necessary information, are key simple ways that physicians can help lower adult smoking rates. Healthcare professionals have failed in the past to consistently advise individuals who smoke how to quit and provide them with essential information and resources. So the goal for this strategic issue is to provide physicians with education, tools, confidence, and motivation to work with their patients. And the action plans that follow this goal include offering educational opportunities through seminars, teaching communication skills, role-playing real-life incidents, and providing handouts that they can give to their patients in their clinics. Adult smoking in Weld County continues to be a public health issue. However, the more that we focus on community health plans and implementing education, the greater chance we have for reducing the risk of adult smoking and secondhand smoke to those around them in the community. Thank you for taking the time to listen and to review my PowerPoint presentation.